Is the worst yet to come, Dr. Fauci?
Yes, it is.
Can you elaborate?
Well, whenever you have an outbreak, that you can start seeing community spread, which means by definition that you don't know what the index case is, and the way you can approach it is by contact tracing. When you have enough of that, then it becomes a situation where you're not going to be able to effectively and efficiently contain it.
To unleash the full power of the federal government in this effort today, I am officially declaring a national emergency.
What's the situation, what's your greatest concern in terms of what you're seeing in hospitals?
I mean, I think the hospitals and institutions and healthcare workers are doing their best. What we're asking actually is we're asking for a consistent unifying message from the CDC and the top. We are doing this as an educational series to educate the public about the COVID-19 crisis and infection from a perspective of actually a person who's been through the experience of having COVID-19 and been hospitalized. I think you hear a lot from a lot of doctors, a lot of healthcare workers talking about it, but I think if you hear it from a personal story of someone who's been through the process, it will make it more powerful and, and help you understand that this is actually a serious issue. Achin is a Kurdish American. She is actually a nurse and a faculty at Belmont University. She actually was diagnosed with COVID-19 and was in the hospital for 8 days.
First started having symptoms around March 9th, which at the time, I think it's important to note that in Tennessee, there was only, I believe, about 2 cases confirmed. And then that Monday, the symptoms just started. I think the biggest thing is the dry cough.
Oh, was it easy for you to find testing?
So testing for me was hard to find because I was one of the first few that got it, and tests weren't available. They weren't readily available anywhere.
What message do you have for the skeptic people who still think everyone's overreacting? And this is also for our immigrants and refugee community, because due to language barriers, people trust a lot of the social media and WhatsApp group to share things with them. But you as a healthcare provider and someone who had the virus, what would you tell people?
I would definitely say it's the real deal. I mean, some people, it doesn't hit them as hard as it does necessarily other people. I myself didn't develop pneumonia. I work in a hospital. I keep in contact with my friends that still work at the hospital. And I mean, people are dying every day. It definitely is the real deal.
Nobody really knew whether or not to take it seriously. It was, for the most part, abroad, so we weren't really directly affected. And then I feel like overnight, it just kind of, the vibe about the virus totally changed.
When you heard the word COVID-19 coming to your emergency room, describe the emotion to our audience, how you felt that time.
My answer to that is always training. When you're trained to sort of respond quickly and you're task-oriented in these encounters, you just kind of jump right in. And it was sort of the same thing initially with COVID-19.
Not only doctors, nurses, and all the healthcare facility who works all the time to take care of the patients are the only essential workers or the ones who are needed. We also have to thank the people who work in the farm.
So I think the most important takeaway from this campaign is that there's a lot of false information going around. What these live streams stress is that you should really be wary about where you get your information from. It should only be coming from scientists and doctors. You hear a lot of information about how many deaths there are and how many cases there are, and it seems a little scary, but hearing someone talk about their perspective and to hear what they're going through, it kind of makes what's going on more relatable in a way. So hearing their stories, it kind of makes you more aware of how bad this pandemic actually is.
Thank you to all of you who have taken their best efforts to try to avoid the spread of COVID-19. That can be anything big to small, whether you're a healthcare worker or whether you're just adhering to the CDC's guidelines with wearing a mask, as strange as it might be, in public, keeping 6 feet away. I know everybody's lost a lot in the past few months, but I just really want to applaud you all for those sacrifices, and they're big sacrifices, and tell you that it was worth it, that it has circumvented the spread of COVID-19.